Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale, Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. I see a lot of patients now that are coming in asking for a GenXLift. And a GenXLift is something that I've developed over the last couple of years in response to patient need. I have been practicing facial rejuvenation for 22 years now, and I really have seen a subset of population that for whatever reason may feel that they're not ready for a full facelift. And those reasons generally are that they can't tolerate the downtime, they feel that financially they're not ready for that kind of expenditure, or they're just afraid of going to the operating room, or they're afraid of, kind of figuring out they need a facelift. So a GenXLift is a staged procedure that addresses those needs of the Gen-Xers, and those are the people that are the ages between 33 and 53. So what downtime is involved with a GenXLift? That's a very common question. Well, it really depends upon what we're doing, and there's a staged procedure here. So in the early stage, or the younger patients for the GenXLift, that involves some laser therapy. That is a MicroLaserPeel along with profractional laser, what we call a 4-day laser peel. The beauty of this is it takes care of the pigmentation problems and involves a profractional laser that helps tighten the collagen, minimize the pore size, and also smooth the wrinkles. Both of those together have about a 4-day downtime. So the beauty is after around 4 days, you can put some makeup on and no one's the wiser. The other thing about the stage 1 GenXLift is that it involves some fat transfer. So I actually take some fat from one part of your body, I spin it in a centrifuge, and I re-inject it wherever we've lost volume. So generally beneath the eyes, sometimes the upper eyelids, the lips, corners of the mouth, along the jawline. Whatever we think that we need to do, we would go ahead and do, and that can be done in the office. The downtime for that is anywhere about a week or so. So I think it's important to decrease your intake of any aspirin, ibuprofen, a lot of herbal therapies, vitamin E, fish oil. So those are the things that can make you bruise and swell. The next stage of the GenXLift is stage 2, which is the first stage plus something to address the neck laxity and increase the contour of the jawline. Generally, that can be addressed with ultherapy, some liposuction, or something called ThermI-RF, which is a radiofrequency treatment that helps tighten the skin. Neither of those have really significant downtime. So really, stage 1 and stage 2 have about the same downtime, with most of the swelling, and if you have any bruising, would come from the fat transfer. So we're talking about a week here. The last stage of the GenXLift involves the first 2 stages, possibly, along with a short scar facelift with some deep tissue elevation. So that short scar facelift actually is a, if you will, a mini facelift along with some deep tissue elevation. So that deep tissue elevation is key because that elevates the facial fat back up to where it used to be. It tightens the jawline all through much less scars. So along the sideburn, inside the ear, generally down to the earlobe. The recovery or downtime for a short scar facelift with deep tissue elevation is somewhere around a week to 10 days. So as long as you don't have a lot of things that make you bruise, the swelling is not really that significant. So really, again, the combination of all these things generally leaves you about a 10-day downtime with many advantages here. There's less scarring. Psychologically, you feel as though you haven't really gone down that road of a full facelift yet. You may find it kind of hard to accept at your age that you may need a facelift. You also get the advantages of possibly having it done in the operating room or in the office. Generally, people have it done in the office under oral sedation and some local anesthetic, and it tends to be more affordable. So the best way to figure out if you're a candidate for a GenXLift is to come in with some old pictures, have an idea exactly what's bothering you, so we'll check it out in the mirror together and come up with a plan. Thank you.